Welcome. Ruth Ann Rigby. We're glad you're here.
I'm so glad to be here.
So when was the last time you were at Cumberland Heights?
I was here about a year ago.
What were you doing?
Just visiting.
Just hanging out?
Mm-hmm.
Tell us what you're doing right now.
I'm doing many things. I just took a new position with J. Flowers Health Institute out of Houston, Texas as their Chief Strategy Officer.
Congratulations.
So I'm very excited about that. And I'm just doing what I do on a day-to-day basis, helping
That's right.
people.
You're my Mississippi friend. For those that don't know, both Ruth Ann and I, which I had to tell you about this maybe, 2 years ago or so. We're both from Mississippi. I'm originally from Starkville, as we would say.
Stark Vegas.
Don't
they call it Stark Vegas?
They do.
Yeah.
They certainly do.
Yeah.
And you're outside of Jackson, Mississippi, correct?
Yes.
That's right. How long have you been there now?
That's a great question. My husband and I lived in the same house I grew up in my entire life until a year and a half ago.
Wow. That's a change. That's
a huge change.
Huge change.
And we bought a new house about a year and a half ago up north in Canton, Mississippi. And we live out on a farm. And it was a whole new world.
I love that.
Because I'd never packed up a house. I'd never set up a house or anything like that.
Did you learn anything new? I mean, what was the experience like?
It was really interesting because I'm also a stroke survivor.
Okay.
And
I didn't know that.
One of my girlfriends, Marlena, had to come in. I had a lot of my girlfriends helping me pack up. You know, it's good to have friends that are therapists. You know, Ruth Ann, have you started packing up your house? You may want to consider doing that. I was like, do I need to come over there and help you? Yes. And so one of my girlfriends, Costas, she started helping me. And because I was like, I'd never done that before, so I didn't know how to do it.
I bet it was an emotional experience to some degree.
I threw away so much stuff. Well, let me rephrase that. I donated, World Book encyclopedias. I mean, like that was the house I grew up in.
Of course.
So it was nostalgic, but it was also very therapeutic to be able to just start fresh. Yeah. And so my girlfriend Marlena, she owns a great kitchen store back home. And literally I was traveling so much and she went in and set up my entire kitchen. So I highly recommend that for people that are buying new houses. Get somebody to set up your kitchen for you because it works.
That's a good friend.
And so when I came home, everything had a Post-it note on it. So until I learned where it was.
Perfect.
So that's pretty cool.
Did your husband like that too?
Yes, he did.
He did.
He
didn't
takes.
have to.
I don't cook. He does. So he's.
Do you clean or does he cook and clean?
No, I clean.
Got it.
I clean. So that's my role.
It's a good partnership.
Yeah.
That's exciting. I'm glad that you guys are in a new space, new adventure, still in the same area.
Yeah.
But just new things. Do you have chickens and goats and pasture ornaments?
No, but we're getting ready to. We have cows down south on our farm.
Okay.
And so we were going to I really want to get some miniature horses.
Okay.
And some miniatures. I grew up with horses. I could ride before I could walk, and I'm a horse girl.
Really?
Yes, and I showed competitively too.
Really?
I showed hunter jumpers. I did.
I did not know that.
Yeah.
So tell us about that. Tell us about, so this is where you grew up.
Yes.
Right?
Yes.
How did you've worked in this field for
a long time.
Yeah.
Yeah.
So just to be completely transparent, when I came to work at Cumberland Heights about 5 years ago, I was working in treatment for, another 5-6 years before that as a graduate student.
Yeah.
And so when I came to work here, I heard all about Ruth Ann, and we got connected probably through conferences and all that, and collaborated in Charleston last year in a conference. And I have come to really love and admire our relationship and yours to our organization and everything that you've done. We're going to get into some of that, but everything you've done really nationally to support people that are affected by addiction and families. So give us a story a little bit of how you went from a show jumper to a professional in the behavioral health field.
Yeah.
What's that story about?
Well, that's a great story. I didn't get here the easy way. I call it my other life because this is my recovery life. March 1, I picked up my 26-year chip, which that's God's grace.
Congratulations.
So, that's a miracle. And it's a lot of hard work that goes into that, as you know. So I grew up in Jackson, Mississippi. I had a mother who was an alcoholic. So I can remember very young when I was very much affected by her alcoholism. Mm-hmm. And, she was never present for, things that I was doing when I was a child. And just because she was it was just part of who she was at that time. Mm-hmm. My mother got sober when I was 18. She had 25 years of sobriety when she passed away, probably 16 years ago. And, she went from being a person that I despised because I was a child of an alcoholic to a person who was my hero, and I absolutely adored her. And, that's the beautiful gift of recovery. And when families get into recovery, the whole family can heal.
Right.
And so, that was a very unique experience. But she missed those opportunities with me, with my showing horses and things like that. She just wasn't, that was my escape, honestly. I've always had horses. When I was a very young child, my mother bought this black pony named John. John. And she went and picked him up in her station wagon. She made them take the seats out and put John in the station wagon.
A horse?
Yes. It was a pony.
Okay.
Pony, not a horse.
Excuse me. Pony.
And so, she just, that's who she was. And
she got it done.
She got it done no matter what. And
John was probably uncomfortable.
John was fine.
Okay.
So when my parents would be asleep in the house, I would go out and get my pony and bring him in the house.
Oh,
I would
really?
literally bring him into my room as a child. And I would go take him out before they woke up.
Really? Because that was a no-no. We don't want John in the house.
I had great skills as a child.
Wow. And John probably learned to be quiet as we're walking through.
He didn't do anything. He didn't poop in the house. He didn't do any of that.
Really?
Yeah. I just wanted him there with me.
He would just hang out with you.
Yeah.
That's a cool story. That's
And
hilarious.
I started scuba diving when I was 11, and I became a dive instructor.
What?
Yeah, I did. There's probably a lot of things you don't know about me, but it was another great escape from my house. So my dad would make sure that I was, I was farmed out, I would say. I would go scuba diving every weekend in Florida with the dive team. Well, once a month we would go scuba diving down in Pensacola. And that was just a great escape. There's nothing better than being in the water. And we had a pool at our house, and we could swim all year. So there was nothing better to me than going and throwing on my gear and getting on the bottom of my pool, and nobody could find me.
Right.
And I would just sit there for a long time. But
and for those that haven't scuba dived, it's another world.
It's a whole nother world.
It's one of the more electric experiences I think you can have.
So I became a dive instructor at 18, and then I had a horrible diving accident.
Really?
Yeah. A group of us who were instructors went down to Pensacola, and we were diving we were lobstering. And back then, everything's digital now, your tables, everything. But back then, you calculated it. And it was my second dive of the day. I do not remember that dive. I probably never will.
Wow.
But I lost consciousness at about 80 to 100 feet. And the people that were with me were able to get me back up on the boat. But we were so far out that the radio would not reach all the way in. It actually reached another boat that actually had 2 nurses on it. And then they were able to, they had to do CPR on me twice. This is all told to me because I don't
You were
remember.
out.
I don't remember.
Wow.
And so they took me in, and then I was put in a helicopter and taken to the Baptist Hospital in Pensacola. And I was there probably for 12 hours maybe. They got me stable, and then I went to the Navy base and was put in a decompression chamber for 48 hours.
Yeah, they had to put
with Navy SEALs.
From their dives.
I mean, they had a whole medical
team. Do you remember
team.
that?
Oh, I remember bits and pieces of that.
Wow.
Because now, you go to centers that have the chambers.
Right.
But I was very lucky to be able to go to the Navy base in Pensacola.
That's right. If you would have been somewhere else, it would have been a different situation.
It would have been totally different.
Wow.
Yeah.
Wow.
So, my mother would tell you that I've used up 9 lives, so I've had a pretty wild ride.
Yeah, it sounds like it. So want to swing back to your mother and her 25 years before she passed. Was there a time period that y'all were able to share in recovery together?
Oh, yes. Tell
us about that. So how long did that happen? And
so I got sober in 1997. And that was my husband. We had only been married for a very short time. We had been married for 6 months, I think. I met my husband on my farm. My husband is a highway patrolman, and that was his second job on my family's farm with my cousin and her family. And I saw this man struggling in pasture one day. And I stopped. I jumped the fence. I caught the pony, and I gave it back to him. And I introduced myself, and I got back in my car. I called my mother, and that's back when cell phones were really, really big.
Okay.
Probably before your time. And I called my mother, and I said, I've met the man I'm going to marry one day. And I married him 4 years later.
All right.
And so I was brutally attacked at a gas station on the way home from work one night. I just stopped to get gas. It was probably 2 miles from our house. And I did not realize, I was just pulling in to get gas, and I was brutally attacked. They tried to kidnap me, and that's when my life forever changed. And nobody would help me there. Nobody. And so I was able to call my husband, and he and a couple of people came and helped me. And
so you broke away from these attackers.
I fought.
What you're saying is there was folks maybe around the gas station, or they wouldn't help you at all.
Yep.
Really?
Yep.
Wow.
And so, I grew up with an alcoholic parent, so I have the gene. And I became something I said I never would be. But we did not know about trauma back then, what we know today. And so I was having flashbacks, night terrors. And so what does one do when that happens? You go to the physician. You go to your doctor. And I would go to the doctor. I have headaches. I'm having this. He would medicate me. I would feel a little bit better. It would numb me up. And so then my visits got more frequent. I was going 3 times a week. And on Fridays, I would go in, I would be shot up with all the medication. Then he would give me a prescription to get me through the weekend. And keep in mind, I'm married to a law enforcement officer now. And one Friday, I got shot up. I had 10 minutes to get home. I always timed it very creatively. But I thought my prescription was very important that day. So I needed to go to the pharmacy.
To pick it up. For the weekend.
And I passed out in the pharmacy. And my husband had to send his men to come get me. And I was not, and then I added alcohol on top of it. And so in a period of 6 months, I weighed 90 pounds and I was almost dead. And, my husband was newly married. He didn't ask for this. And he was assigned to the governor. He was on the governor's security detail at that time. He ended up being Governor Fordyce's security chief. And so I went in for, we'll say, an assessment at a local hospital there in Jackson, and I manipulated my way out of it, and they told me, Miss Rigby, you don't have a problem. And then about 2 weeks later, it got so bad. Thank goodness my husband had the people he could ask questions to, like the people at the Bureau of Narcotics. This is what's going on with my wife. What do I do? Well, if you love her, get her some help. If not, go buy her a cemetery plot. She's going to be dead pretty quickly. And they could ask. I was not very creative. I went to one pharmacy. Now we have the PNP. You could really check it. Back then, you just get printouts.
That's right.
But, and so I was fast-tracked under a court commitment to the state hospital at Whitfield, which is our state facility. And that's where I needed to be. I was probably in detox for about 3 weeks until I came to, and I had a great team there. And again, I was under a court commitment, but first of all, they thought I was a narc. They didn't know why I was there. I mean, these are the other patients.
Sure.
But, and probably when I came to, I was like, oh my God, what am I doing here? How did I get here? I was in a really bad blackout. And my counselor, Sandy, asked me to come to her office, and she said, you can't leave. I was like, well, yes, I can. I'm calling my attorney. You can't keep me here against my will. And, and she says, did you bring anything to treatment with you? And I said, yes. And she said, what did you bring? And I said, I brought my Bible. And she says, I want you to go up to your room, and I want you to put your Bible under your bed. And when you actually hit your knees, I want you to pray for acceptance and surrender. And when I did that, my life changed, because it talks about a spiritual awakening in the big book, and that was my spiritual awakening. And when I did that, everything in my life changed. And I grew up in a Baptist church. I'm very Southern.
I understand.
And but I'd never hit my knees. And in my faith walk, that was how I survived as a child. I was at church on Wednesday and Sunday nights, and that was my survival for everything that I was going through. But when I made that decision to turn my life into my will over the care of God as I understood Him, my life changed.
So were you guys introduced to 12-step recovery in this facility at Whitfield?
Yes.
Okay, so that was a part of it too.
Oh yes, it's a big part of it. And we did have some extra things that the First Lady would send food out there on the weekends, enough for everybody. It was just a way to support and give back. But I knew I wanted what my counselor had.
Ooh.
I knew it.
Right.
I wanted what my counselor had. I
Right.
wanted it. And I never asked when my discharge day was. I never wanted to know. I wanted it to be based on my progress. And I was in treatment probably for almost 6 months.
So you were ready.
Yeah.
Right?
Oh, yeah.
Sounds like
I was
you were
ready. And I've never not done what they asked me to do. I had to make we as a couple, a newly married couple, had to make some healthy decisions. And right then, my family was toxic for me. And so, my husband and I bought my mother's house when we got married. And so we did not go back to the house that we lived in. We had our puppy, and we got an apartment out near the hospital because that's where I felt safe.
Wow.
And we didn't have any furniture. We lived on an air mattress. And I was a really bad workaholic in my other life. And so that was I had to put some things in place to stop that. And I would work, 18-hour days, and I was in retail, and I was known as a fixer. If your bottom line was, I just did a little bit of this and that.
You have lived 9 lives.
So my mother says she would.
You really have.
She would be kidding me, and I've had medical challenges in recovery, and it's just by God's grace I'm here, and I'm here to do what He has called me to do, and that's to help people on a day-to-day basis.
So when did you know that? When did you, through your recovery journey, did you start to say?
So when I got out of treatment, I started volunteering immediately.
Where?
I volunteered at St. Dominic's Behavioral Health North Campus. And that's actually where my mother went to treatment when I was 18, but it was called Doctor's Hospital then. And there was a lady when my mother went to treatment by the name of Ruth Searcy, who was her counselor. And imagine when I walked through the doors to volunteer, who's still there?
Of course she was.
But Ruth Searcy. Yeah.
And did she know you?
Oh, yes, she did.
Of course she did.
Oh, yes, she did. Mm-hmm.
Right.
And so, God just did for me what I couldn't do for myself. I started volunteering there. I went back to school to be an A&D counselor, and I stayed there for almost 10 years.
What was your role there?
I started out as a tech. I learned, and it was the greatest foundation. And I always tell people, if you're going to get a true foundation, do it in a hospital, because you learn so much in a hospital setting. And, even as a tech, you learn how to take vital signs and do these things and charting. And it was a very positive experience for me. And that's back when we could keep people for up to 28 days. And, it was a great, great experience for me.
Yeah. We've heard that a lot. I mean, just in my professional and personal experiences. Folks that start off as a tech somewhere, whether it's a hospital or a treatment system or something, just the day in and day out of how to cultivate and be a part of an atmosphere of recovery in a treatment setting, which is different than recovery.
Right.
It's much different than recovery, and how that kind of it does one or two things. It either motivates you to do something more in this field, or it motivates you to pivot a little bit, which is also great and a beautiful thing. But it's a unique part of our culture that sometimes we're so inundated in it, but so many people that have a personal experience are working in this field, and it colors, again, like I was mentioning, sort of this atmosphere of change that I think people get to experience. So you're a tech, you're early in recovery, you're in Mississippi, you're early in your marriage, which, is a change process in and of itself, right? And from there, you become an alcohol and drug counselor in the state of Mississippi.
Yes.
And so I assume you started being a counselor there.
Yes.
And what happened after that? Where'd you go?
I was just involved in community. I was put on the State Drug Court Advisory Board. I believe in getting involved in your communities. After I left St. Dominic's, I went to Pine Grove Behavioral Health down in Hattiesburg, Mississippi.
That. Okay.
And I was there for quite some time.
Is that how you met Chappie?
Yes.
Okay.
Yes, that's how I met Chappie. Yes.
Okay.
Yeah.
You got connected.
Yeah.
Yeah.
And, it was a special time there. And like each leap that I've taken has been very impactful in my life. Very impactful. And when I started their alumni program.
Really?
Before alumni was hip. Before we had TPAS.
And recovery care advocates or peer recovery sports specialists and all that.
Before we had all of that.
So I would imagine that while at Pine Grove, you might have gotten connected to somebody whom we also love at Cumberland Heights named Eileen McRae.
Eileen and Dr. John. Yes. I love the McRaes.
Yeah.
Yeah.
They're great people.
Special people. So there is a group of women, Eileen McRae, Eileen Warwick, Ruth Searcy, and Sister Paulina's Oaks. I call them affectionately the white-haired club, but then they refer to themselves as the blue-haired club. And Catherine Turcott was part of that, who was a great influence. We all worked together. We just did some amazing things in the state of Mississippi to help the sick and suffering and families. And
y'all really have. I mean,
oh my gosh, Eileen has been such a mentor to me, and
she's an incredible woman. She loves full-hearted,
and
and
with everything she has.
And it's a beautiful thing to watch. In fact, in the most healthy way I can just say, like, it's an envious thing, right? As a younger person in the field, if you will, in terms of experience, like to look at you all and the community y'all have created over decades, and say that's special, that's unique. How you can call on each other. You know what I mean?
Oh, yeah.
To help people all across the Southeast, all across this country. One thing I wanted to tell you, one of my first observations about you that I want to make sure that I continue to step into as a person who works in this field is every time I'm at a conference, no matter what the conference is, most of the time I'm going to see you volunteering.
Yes.
Right? Whether you're on the program committee or maybe you might even be running the whole show, which I've been. Whatever it is, I always see you with a scanner at the very least.
Yes, very least.
Scanning somebody's CEUs, right? Answering questions, just being a part of it. And I think that that's a special thing and speaks to your character. I was also at the last year's conference when you got the volunteer award presented by none other than Gary Fisher.
Yes.
And there was not a dry eye in the whole room. And so I just want to say, from the middle of my heart, just job well done.
Oh, it's about being of service. Yeah. And, both my parents volunteered quite a bit. So I get it honestly. But when I went to Pine Grove, I started volunteering because it was a different role. And then they moved me into development and, to meet people. Do what?
Were you still at Whitfield when you started volunteering at Pine Grove?
No.
Okay. So this had all changed. And you just said, I'm going to volunteer.
Right. And, when they started assigning me to go to different conferences and everything, that is the best way to connect to people is volunteering.
Maybe this is interesting. I'm just having this thought. Maybe the key to a successful career is to volunteer first.
I think that's a great idea.
It sure has been, just from the outside looking in, a part of your journey almost at every stop.
It is
just being a part of and just saying, look, I'm just here. And if God's going to show me a new door and opportunity, that's great. But that's really interesting.
Yeah, I even learned how to play golf to meet people. I'm not the best golfer in the world. My mother was what is it called? An A scratch. A scratch golfer?
Scratch golfer, that's right.
My mother was that.
She was good then.
Oh, she was very good. She went to Southern on a golf scholarship.
Really? Mm-hmm. No kidding.
Yeah.
So talk to me. I when we were in Charleston last year, and help me with the name of the conference. I'm sorry.
It's the Leadership and Addiction Summit, powered by SEED.
Which was the first one that you did last year in Charleston, because it transitioned.
We transitioned from the Southeastern Eating Disorder Conference,
that's right.
SEED for short, to the Leadership and Addiction Summit because we came through COVID. We just felt that we were pivoting in a different direction, and it was very well received. And we were there in Charleston. We're going to be in Nashville this year.
Shout out Nashville.
Come
to the conference. When is the conference?
Well, it's August the 18th and 19th.
Here in Nashville. Can you sign up today?
Oh, yes, you can.
Where?
You can sign up at our website. It's the leadershipandAddictionSummit.com. They just flipped the domain yesterday, so you may have a little bit of a challenge, but it should be all populated by today.
One of the things that I wanted to just highlight about that event from last year in Charleston when I was there, my favorite part was meeting with and hearing this gentleman, and you're going to have to help me with his name, but he's associated with the Mississippi Highway Patrol. Because something that's similar to us is the West Alabama Narcotics Task Force saved my life and had to intervene, right?
That's Colonel Stephen Maxwell with the Mississippi Bureau of Narcotics.
That was in Charleston.
That's a division of the Department of Public Safety.
And it was so refreshing because I think, especially over the last 15, 20 years, there seems to be pockets of a renaissance with law enforcement and their relationship with people who struggle with addiction and from a well-being perspective, mental health, or any kind of co-occurring disorder. And it's, I want to give Mississippi some credit, right? Because sometimes Mississippi doesn't get a good rap for some things, right? The state bird being the mosquito and all that kind of stuff, right? It's a beautiful place, and I love Mississippi. I'm a native to Mississippi. But talk to us about your involvement, and it makes sense with your husband and his experience in law enforcement, but talk to me about those programs and the colonel, because the way he talked about addiction was pretty unique.
Well, we do a lot of things with the Bureau of Narcotics. One of the things that was we did in Mississippi back in 2012 was we created the Opioid and Heroin Summit. And we created it specifically with partnerships in mind, partnerships like the Mississippi Bureau of Narcotics, Mississippi Public Health Institute, the Mississippi Department of Mental Health, all those agencies that can truly come together and impact community. And, my husband, Jody, will tell you that he really didn't know what I did until he retired. And he was traveling some with me. He would hear me working with families. I was put on a task force to help law enforcement when he was still on the patrol. And, being a wife of a first responder, being a wife who's also an alcoholic and drug addict in recovery, I wanted to break the stigma because we need to be able to help as many people as possible. And if they can see people like us recover, if I can recover, anybody can recover. But Colonel Maxwell has a very special gift of getting the point across in a very loving way. He wants to be able to, and their agency for that matter, they help people up. My husband will tell you he was used to putting people in jail who struggled. But with our relationships that we have formed with them through different conferences and things like that to bring awareness, they have learned that they can help people. And Colonel Maxwell will tell you that. We work together diligently to be able to access resources for people to get care, whether they have resources or not.
A couple things are interesting about that. You started this summit for heroin and opioids in 2012.
Yes.
Which was kind of the first start of before the Oxycontin was prevalent.
Right.
And heroin came right behind that in our communities, especially in the Southeast. But prescriptions per, average prescriptions per 100 persons in our communities was out the roof, right? This is a little bit before the PMP too, right? It was just being put together. In terms of, so for those that are listening, just in terms of how we kind of codify or understand how many prescriptions each individual is having before this system, right? It was individualized as a function of your provider and your pharmacy. So that you wouldn't know that me, for an example, had 10 prescriptions spread out across 5 providers. And now we have that key just to better help people. What I loved about, so there's an observation, y'all were on the front end of a lot of that work. And the thing that I loved hearing about from the Colonel is how to create change, his change process that he was talking about.
Oh, in his organization.
Yeah. Sheriff by sheriff, community by community, because you're right. I mean, if you're not touched by addiction, well, let me say this. If you're not touched by recovery, because I think almost everybody's touched by addiction, we all carry assumptions. I certainly did before I myself got in recovery about what addiction's like, who experiences it, what hope looks like. So what I really loved is his passion about building relationships with the leaders, the law enforcement leaders across the state, and how that's driven change. But it's not been linear. It's been up and down.
It's up and down.
Yeah.
He created a culture within his organization about wellness. He wanted his agents to be able to access care no matter what, and to be able to create a true wellness program. When people think about wellness, they're thinking about physical activity, personal trainers, nutrition. He takes it a step further and does mental health wellness, because you have to remember these people are working sometimes undercover. They're running into danger. And so he set up a whole program where they can call somebody confidentially, and he doesn't have to know about it. He created a safe space for wellness.
Right.
And it's really caught on throughout our state. My husband and I co-founded an organization called First Responders of Mississippi with some great people about 6 years ago. And we were in Columbia, Mississippi, with the police chief there. And he's created a culture there within his own organization for wellness. He wants to keep his men and women well and whole. And, that's actually what recovery teaches us, to be well and whole. And so I just like the things that they've created change within their own organizations, and it's catching on.
Right.
It's catching on.
Yeah,
and that's what I love.
When the Colonel was talking about it, it was almost performance-based.
Yes.
In the sense of like, hey, this is the right thing to do, to invest in people in terms of their mental health.
Right.
And that's what we're all discovering, and that's what recovery teaches. You're right about the link between, physical and mental health. But I loved how it's like, that's a net positive to help people and make sure they're safe. But it's also a positive because they're going to be a better version of themselves at home and also in the force, right? Whether that's a part of being a highway patrolman or a sheriff or whatever you're doing. And I really loved that. I thought that was really special and unique. How has this experience over the last 15 some odd years with this work, with law enforcement specifically, impacted families and family recovery in the state of Mississippi from your perspective?
I think it's made huge changes. It's huge. Where families know that they can get help. They know that they can get in recovery, and they know that they can heal. Yeah. I think you have to create a safe space. You have to create a place for hope and healing. And, for so long, we have not been able to talk publicly about, people are talking more about it. We do recover, hashtag we do recover, recovery out loud. And I think the more people that share their experience, strength, and hope in their journey, no matter what their journey is, will allow people to get into recovery one way, shape, or form.
Yeah. Mississippi has also done really good work by way of Collegiate Recovery.
Oh, yes.
Eileen's been involved in that, and Nell Cohen.
Yeah.
Now they're at Auburn, but she was a great champion of that. And our friend Blake Schneider, who's now at Kennesaw State University, supporting their Collegiate Recovery program. And so it's been interesting to see some of our public universities in the region kind of be transformed by that.
I think that college up in Starkville, is it? I think they have a collegiate recovery.
They sure do.
Yeah, they do.
Mississippi State, the Bulldogs, absolutely. Yeah. One of the things, and I think you know this about me, but I was a student in the Texas Tech University Collegiate Recovery program, and my great friend Nico Dorn and I, he was a
Look at old Nico soaring right now.
Soaring, right? Isn't it incredible? Him and Bobby Ferguson and what he's been able to build in Austin has been, just as his friend, I couldn't be more proud because we got sober together.
He's a good man and a good daddy.
He's a great dad. They have a lot of babies right now.
Yes, they do.
So I tell him over and over again, hey, take a nap.
Yeah.
Take care of yourself, give yourself a break, because he's so focused on family and he's so focused on making sure that Alpha 180, Alpha Behavioral Health, as they've just rebranded, is doing good work out of Austin, Texas. But one of the things that's really unique, and it reminds me of your first responders programs, is that Collegiate Recovery programs change the culture of the universities that they're in. So here's what I mean. When I showed up to Texas Tech, which I was like, what am I doing here? Right? It's flat. All the trees are planted by humans, which begs the question where all the squirrels come from. Like but it's a beautiful city out there in West Texas, and their Collegiate Recovery program not founded, but at the time was being ran by Dr. Kitty Harris, whom I think you know.
Yes.
You show up and there's 120 kids in recovery in this beautiful, 15,000 square foot some odd building right across from the president's office. And you're thinking, what's going on here? And what I loved mostly about that program is how just by way of those students being empowered to be on campus, they're really transforming lives indirectly. So here's an example. All those kids are going into classes and meeting people and studying with them and sharing about their lives. And it could be a mathematics class, it could be an engineering class, maybe it's a therapy class or a psychology class, right? And they're meeting someone like you, and you're sharing a little bit about, hey, I'm in recovery and I used to use drugs and alcohol every day that ends in Y, and this 19-year-old or 20-year-old saying, really? Tell me about that. And it's those little things that are hard to measure,
right,
but are having a broad impact in that community. And I've seen Mississippi State change in how they celebrate recovery. Like if you just look at some social media stuff that's tagged with the university or the president coming down to an event, like that's unique.
Yes.
And that's a part of what you're talking about with families and with first responders and folks more than we've ever had access to before, saying, hey, recovery's possible. And how do we, like I love what the Colonel and you talk about, how do we bring people up instead of lock them away?
Yes.
It's changing our relationship to that because, you and I, if we wouldn't have given those wouldn't have been given those opportunities as two examples of recovery, we wouldn't have been able to be here, which is really unique. So that's a beautiful thing. So tell us about your new opportunity for those that don't know. You're now with the J. Flowers Institute.
Yes. I made that transition in February to J. Flowers Health Institute, and I work with Dr. James Flowers and Robin Mooney.
That's exciting.
They both are co-founders of J. Flowers Health Institute, and they've been open for about 6 years. It's just extraordinary the work that we're able to do at J. Flowers Health Institute. And I've been a referral source there, just like I'm a referral source here, getting people to the right level of care and getting the help that they truly need. With J. Flowers Health, I've just seen miracles happen in different ways. We have people that have a lot of medical issues,
right,
that may be cross-addicted, or they have behavioral health issues that they really can't put their finger on. They've just been going to provider after provider, and with J. Flowers Health being right there in the hub of the Texas medical community, we're able to really partner with some incredible providers there that are on our provider network, if you will.
Yeah, my perspective of J. Flowers is that they dive deep.
Oh, unlike anything you've ever seen before.
Really?
Yeah, and we call it a living MRI. That's what Dr. Flowers refers to it as, a living MRI, and it's absolutely a living MRI.
So what does that mean for a patient generally?
That looks like, it depends on what they're struggling with. We have seen miracles in many different ways. We've been able to help people who did not know that they had a tumor on their pituitary gland, and they were acting funny. We really take a deep dive from head to toe and all in between.
Right.
And it's a process. We can take care of people that are that need very high acuity levels of care in a private sector. They don't have to have that institution feel. we love them back to health, is what I like to say.
Yeah, like a systems approach to wellness.
It is.
Right.
And it's really unlike anything. I really encourage people to come experience with us, come and do a tour, and they can contact me about that and meet with our team. Because, I've worked with many, many different families, and some of the families that I've been able to send there have truly been and they don't have to necessarily have a substance abuse problem. So
I didn't know that.
They do not have to have a substance abuse problem to come to us. They can have complex medical issues. They can have complex behavioral health issues. They can have eating disorders. They can have sex addiction. Something is just not making this make sense. And so, with our treatment team that we have available, we can really put together a very individualized treatment plan for that individual. And it may be that they need to stabilize first, and then we start the evaluation piece. But we're right there on the campus. I call it the Houstonian Resort there in Houston. And then our offices are literally, probably 1,000 feet.
Breaking down silos between providers.
Yeah.
Y'all are diving deep, breaking down those silos. I didn't know that it could be medical. It can be. Yeah. It can be psych primary. It can be addiction primary.
Yeah.
That's incredible.
That's the beauty of it.
Yeah,
and,
exactly.
Even we had a dear friend that was diagnosed with cancer several years ago, and he was just getting the runaround. And I called Dr. Flowers. I said, I have this friend. I said, can we fast track him into MD Anderson's? Yes. Working with first responders and their families that need to be fast tracked. He's been able to help us fast track into MD Anderson's and other providers in that area. So, it's all about community, and they certainly have a passion for helping community there.
That's great. We're really glad that you're with them.
Yeah,
it's exciting.
I am too. I'm where I'm supposed to be.
That's exactly right. So, from Ruth Ann Rigby's perspective, what's our challenge today as addiction treatment providers?
It's still breaking the stigma.
You think?
It is breaking the stigma and access to care. A lot of families do not realize that there's a lot of resources available, that they don't necessarily have to have insurance or money to be able to pay for treatment, that they could probably meet criteria for a grant opportunity. And it's really just connecting the people to those resources. And people tell me all the time, Ruth Ann, how do you know so many people? And I'm like, it's what I'm supposed to do. You need to know the resources that are in your state and things. I'll give you an example. So a friend of mine who's in the program, and I've known her for probably 15 years now, she texts me, every now and then, my niece is in trouble, what do we need? And they live up out west. And, she has Medicaid and all this. And,
right.
And so I send her, all the resources that I can come up with about mobile crisis teams. Mobile crisis teams have really changed the trajectory of our care in each state. And, I connected her to those people, and her niece is actually going to treatment today at the retreat.
Great.
So, that's just connecting people.
Right.
But I'm a very firm person who believes in advocacy. And if I can't advocate for those that are sick and suffering, then I can't do anything. And it's very important to get to know the people at your Department of Mental Health, at your Department of Health. COVID helped us really forge that gap with relationships. Mobile crisis teams, in the state of Mississippi, and I'm sure in the state of Tennessee, you can access a mobile crisis team at any given time, and they will come to where you are. It's a team. And if that person is a danger to themselves or others, they're going to make sure that they get to the right level of care. And so, those are things that people that have changed.
Right.
Those have changed that we've been trying to change the trajectory on. And also, making a 3-digit suicide hotline number. We've all worked diligently on that, and that's imperative.
Right. It's interesting that you mentioned that. There's families that are struggling all over this country.
Absolutely.
Tens of thousands of them.
Yes.
To find answers. It might be, what is addiction? It might be, I didn't even know recovery existed. What does that even look like? And then not to mention sort of sifting through the web of the 17,000 approximately providers that are in the United States today for addiction primary, that is. How do you make those treatment decisions? And I don't have a good answer, but I know that your suggestion of creating relationships in a community is probably a good first step.
Yep.
And in terms of being able to make informed treatment decisions, because Google's not always the best gatekeeper.
Oh, no. No.
Quality care.
No, it's not.
And creating those connections with folks who are boots on the ground, working with people day in and day out.
They're the warriors.
They're the warriors, and they're the folks. But it's hard because a family doesn't know. I mean, it's kind of a pet peeve of mine in some ways, but, they're turning to the tools they only know that they have access to. So it might be, a pastor at a church. And most likely those individuals are connected to whoever those providers are, because we don't know. We're not, like you mentioned earlier, we're not familiar with treatment centers. I meet people all the time that are here in Nashville and they're like, you work for Cumberland Heights? And I'm like, yeah, we had no idea until 2 years ago that Cumberland Heights was here.
Right.
Right.
And that's community impact. And, it starts with community, and it starts with being, I'm a member of Broadmoor Baptist Church in Madison, Mississippi. I volunteer out of the Center for Hope and Healing. When I'm not traveling, I work out of the church's counseling center, and they know that I can be a resource to help families that are struggling. And, it's what we do. And, be that resource person in your community. And I challenge people that are listening to this to be that person. Stand up and do something about it instead of talking about it. Get into action and get to know those people, because you will save a life doing that. You will save a life. I talked to so many families, and there was a situation this week, and I was working with this family, and she said, well, people just told me that, they have to have the want to. They have to have the want to, Ruth Ann.
Have to?
They have to. I was like, no, they don't.
Right.
And, I'm changing that messaging, because I don't give up on people. I will go to war to fight for somebody to get the help that they need.
Right.
And, her son is safe today because she listened to me and she followed direction.
Right.
Even if it meant that her son would be arrested.
Right.
She at least knows where he is.
Right.
And, we've had to do that within our own family with my nephews. I don't play that game. I'm not going to get you out of jail, but I'm going to make damn sure you stay in jail until you're really ready.
Yeah.
But,
sure.
I'm blessed that I have several nephews that are in recovery that have made that decision. But, I threatened them with their life that they will never come back to the state of Mississippi. And,
good for them.
It's in there, and it works for them.
Right. And having you as a part of the family or the family team, right, helped adjust that system.
It's really hard when it's in your own family. It's so hard when it's when you're trying to help people within your own family.
And you're talking to your sister about her kids, right?
Yeah. And your brother. And so you have to let somebody else run that point.
That's a good suggestion too.
You have to let somebody else run the point, whether it's the Gary Fishers of the world or the Steve Lees of the world,
right,
or the Deborah Jays of the world.
Right.
Let somebody else run point within your own family.
You can, as an individual in recovery in your family system, you can be a resource. You can be a part of change, but you probably should not be the primary interventionist.
Oh, this is true. This
is kind of what you're alluding to.
This is true, absolutely.
Right? You don't need to be the case manager of this or that person's. Reach out to a Ruth Ann like you were talking about, or a Steve Lee or a Gary Fisher, and help them help your family. And by the way, they'll have because they're outside of the system, they'll have more meaningful change.
Yeah. Or the Eileen McRae's of the world.
Shout out Eileen. So I really love your challenge, because I think I need to hear it myself, which is, hey, be that community advocate, right? Let's stop talking about it and let's start being about it. Whether that's connecting with recovery navigators, which are peer recovery support specialists in Tennessee, or connecting with your local church and just introducing yourself, right? Like, hey, I'm not trying to be large and in charge. I just want you to know that I'm a part of your congregation and this is some of my experience.
Well, and be a part of activities that are in your own community that are not necessarily recovery related, where you can start planting those seeds. You know, it's just, you know, being a part of the Rotary Club. I mean, that's a huge organization that makes an impact. And it's just really tapping into those community partners that can help open their eyes to what you potentially do, but what they do also.
Yeah. It reminds me of our symbols in recovery. No matter the 12-step program that you participate in, they usually, some say, the larger your base, right? The base or foundation of your program, the higher point of freedom you're going to experience.
Yeah. Oh, I love that.
Yeah. And, you know, a part of your base is community. And a part of your base is beyond the meetings that you go to, too. This is an interesting dynamic. Like, you know, recovery exists far beyond just recovery activities.
Oh, yeah.
Is what I'm saying. Right? It exists in your grocery store. It exists in the Rotary Club. It exists at your HOA board meetings, right?
Well, thank God I don't have one of those. But other people do.
But you're exactly right. Being a part of those communities will color your life in a way that you probably don't expect and help, in some ways, you might hope, to be there for somebody that might be sick and suffering.
And you truly,
and that's what it's about.
You know, in recovery, we talk about the more you put in, the more you will get out of it. And that's the same for community. The more you put into your community, the more you will receive. And so, you know, I'm a firm believer you reap what you sow.
Thank you for being an example of that. I have this mental image related to this conversation about you scanning CEUs. And all the recovering colleagues that we have that are at these events, that shout out to them, that we should never have a problem with volunteers at these events, right? And sometimes we do.
We should have waiting lists for volunteers.
Right.
Waiting lists.
Right.
You know, when you're thinking about truly being down at the Starbucks and talking to 2 or 3 people, think about the people that you can scan into a session and you meet them one-on-one. Right. You know, even when we had teams working for me, I challenged my team to go into the sessions and meet the people. Where are you going to meet people? You're going to meet them in the sessions. That's where I met Deborah J.
Really?
Who's a dear friend of mine now.
Of course.
That's where I met Rebecca Cooper. You know, she's retired now. But, I mean, I met amazing people that are my dear friends now because I volunteered.
Right. And because you showed up to the sessions, too, which is sort of another discussion. But go and be a part of, right?
And always learn. Always be willing to learn. You know, what does John McAndrews, one of his songs says? We're always learning. You always are learning.
We love John McAndrew. Yeah, we're certainly glad he's here. Well, Ruth Ann, thank you for being here. It's great to see you at Cumberland Heights in Nashville. I apologize for all the pollen. We're exploding with spring right now.
Yeah, it's killing me.
It's been tough for me too, but we're so glad that you came to visit. Maybe next time you're here, bring Eileen McRae. We need to see her.
I'll load her up in the car.
Load her up and bring her back up here. We need to see her. I hear she's actually doing some volunteer with Pine Grove, which is great.
She is.
We should get reconnected with her, but thank you so much for being here. We really appreciate it.
Well, and if anybody wants to reach out to me, they can certainly go to our website, firstrespondersofmississippi.com, or they can go to jflowershealthinstitute.com.
Incredible. Thanks, everybody.
Thank you.